Good morning, everybody. My name's Bridget Penhale, and I'm the editor of the Journal of Adult Protection. I'm also a co-author with a couple of colleagues of a paper that appeared in the Adult Protection Journal at the end of last year. So I'd like to invite my colleagues to introduce themselves.
I'm Anne Anker, lecturer in social work at University of East Anglia.
And I'm Helen Thacker. I'm Head of Service for Safeguarding for Adult Social Services in Norfolk.
So would you like to introduce us to the paper, Anne?
So we published a paper, as Bridget said, in a Journal of Adult Protection titled Safeguarding Adult Practice and Remote Working in the COVID-19 Era, Challenges and Opportunities. And this was based on a literature review.
Could you explain a bit about the objectives of the paper, Helen?
Yes, we were interested in finding out about the impact of the shift to using digital technology in safeguarding adults' practice and the implications for practice.
So what were the findings, Anne?
So our findings suggest that although remote working in safeguarding adult practice is not new, measures to curb the COVID-19 pandemic gave rise to virtual safeguarding assessments.
Any other findings, Helen?
Well, Public Health England found that the COVID-19 pandemic also exposed existing structural inequalities and disadvantages experienced by older people, those with disabilities, and those from Black, Asian, and ethnic minority backgrounds.
Anything further, Anne?
So we've also found digital inequalities exist and were arguably exacerbated by the over-reliance on using digital means to reach those who are at risk of harm and abuse. And these were also compounded by the unpreparedness for using digital technology to reach those at risk of harm and abuse, and effective structures used to support those at risk during the COVID-19 pandemic.
Were there particular findings at practice level, Helen?
Yes, at practice level, we found that carrying out virtual safeguarding assessments raises a number of concerns about the effectiveness of identification of risk of abuse and neglect to the individual. For example, it limits the opportunities to capture the full extent of the emotional impact arising from cuckooing, modern slavery, financial scamming, and sexual abuse, for example. Virtual assessments also bring concerns about identification of environmental risks, such as risks that might occur due to self-neglect and hoarding, and also concerns about the impact on the assessment of mental capacity and coercive control. For example, it isn't possible to see who else might be in the room with the person or whether someone is influencing what's being said.
What other sorts of challenges did you find existed, Anne?
So we found that digital literacy may be compounded by increased age, disabilities, ill health, or socioeconomic inequalities. Also, skills deficit exists among older adult, and there's also lack of broadband issues, for example, which may be compounded by rural dwelling and vulnerability to cyber criminality, such as grooming, scamming, and online gambling.
And were there also gaps in existing knowledge and practice, for example?
We find that little is known about effective safeguarding adult practice in the era of shielding, self-isolating, social distancing, and remote working. And there is currently exists no coordinated policy that guides digital usage using digital assessment in safeguarding adult practice.
What sorts of challenges did you find that existed from the findings, Anne?
We found that digital literacy may be compounded by increased age, disabilities, ill health, and socioeconomic inequalities. Skill deficit also exists in digital usage among older adults. There's also issue with broadband access, which may be compounded by rural dwelling, and vulnerability to cyber criminality or exposure to grooming, scamming, and online gambling.
And were there other gaps in existing knowledge and practice?
We found that little is known about effective safeguarding adult practice in the area of shielding, self-isolating, social distancing, and remote working. And there currently exists no coordinated policy which guides virtual assessment in safeguarding adult practice.
So with these findings, what sort of recommendations did you make to do with practice and governance, Helen?
Well, our paper makes a number of recommendations at practice level, governance and governmental level. We need to know more about the impact of safeguarding adults via digital technology, and it's essential that this includes the perspectives of people who use such services and also those of professional practitioners involved in undertaking this work.
How can this best be achieved at practice level, Anne? We need to build on strength, resilience, and capabilities. Prepare service users in advance for virtual safeguarding assessments. We also need to identify those without access to digital technology and provide the means to do so. This includes those new to local authorities as well as those who are new. And we could do that by providing the means to do so through personal budget, as one example, to enable them to be able to participate in virtual assessment. We also need to offer training to those who lack the skills to be able to participate in virtual safeguarding adult assessments.
And what do we need in relation to governance, Helen?
Well, in relation to governance, local authorities could carry out a mapping exercise to identify disparities in access to digital technology in their areas. We suggested that central government could consider providing funding to local authorities to invest in and promote the use of digital technology. And we also recommended that safeguarding adult boards could play a role by working with user-led organisations to co-produce guidance about what safeguarding adults assessments might involve. Boards could also offer training to practitioners unfamiliar with carrying out virtual safeguarding assessments to enable them to do so successfully.
And are there some areas that need some further research, Anne?
Government and local authority commission research are much needed. We need to know from practitioners and people who use services about their experiences of virtual safeguarding adult assessment. We also need to identify good practice and effective ways of supporting the needs and outcomes of those who might be who might be at risk of harm and abuse in the era of shielding, self-isolating, or in an environment where social distancing is required. Thank you.